There's a potential negative consequence, harm reduction, right? Empowering conversations after we engage our women who work in this industry. The fact that we lack education for decades, not now.
I feel like we work together a lot of times, but a lot of times when it comes down to like our people who do use substance abuse, standing with experience, with time.
Fighting, killing, the increase in violence among youth. What do you do with all of that?
You want something you want something that you eat and now you're full, you're replenished, you can go to sleep, start up. You're in a new world now. When people like that are here, it kind of makes me feel like I have a purpose.
And no, I would love for you to wait until you can deal with potential heartbreak.
Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Abdi Meyer. I'm with the Somali community of Louisville. I am the outreach coordinator. Today at KY News Media, we have our very, very, very well-beloved guest, Serita Walden. How are you doing today, Miss Sharita?
I am doing excellent.
Excellent.
Doing good.
That's amazing. That's always amazing to hear. Why don't you tell our viewers a little bit about yourself?
Okay. I'll keep it short and sweet. I am from the south side of Chicago. I was born and raised there. I moved here in 2008 and haven't looked back. I love Louisville. I am a licensed clinical alcohol and drug counselor. That is my trade. I've been in social services and substance use and prevention for a little over 17 years. And currently my role, I'm the executive director for Kentucky Harm Reduction Coalition. I've been in this role since January of 2022. So, yes, thank you.
Absolutely, which is so great to have you here because with the topics we have today, you're just an amazing fit. Today's topics will be based around mental health, substance abuse, and also STD prevention, which have been a very key topic for mine for the past 3 years, ever since I joined the community. And one thing we've learned so far is a lot of times we're missing the psychoeducation.
Okay.
So having these podcasts and these spaces kind of give us that, which is very, very amazing. Sharita, I also wanted to ask you, what is one story that you would like to share with our audience today to kind of open it up?
Okay, so
I got you.
So to open up, I like the format, right, of this discussion. And when I think about my intention in coming here today is there's a lot of things that people think is harm reduction versus what really is harm reduction. So a real quick story to share to kind of give people an idea overall of how harm reduction works is considering my one of my newest employees who started officially working with us, think back in October of this year, of 2024. And the reason why this story is significant is this individual came to know us as an organization by way of lived experience. He was houseless. And when we opened up our health and wellness lounge, which is currently located on Brook and Broadway, he was coming in seeking services from us at our lounge. And after getting fed, getting water, using the restroom, he started engaging with our outreach specialists, who then got him connected to a resource in the community for treatment, because this individual became interested in treatment services. Fast forward, he kind of disappeared from us and surfaced back around, I would say, July, and wanted to volunteer with us as he was completing out one of his residential programs. And after volunteering, a position became available, and he asked, could he apply for it? And I share that because that's what harm reduction is creating spaces for people to get their basic needs met. And if there's other things happening in their life that poses risk to their health, their mental health, if they have chaotic substance use, if their sexual health is not healthy, well, we're here to provide the space so they can unpack that And once a person's basic needs are met, then they soar. And now that staff member is currently in school getting their GED.
Oh,
So
amazing. That's
amazing. Harm reduction. That's what we do. And we have plenty of people that have that experience. So thank you for asking me to share a story.
Absolutely. No, I love that story so much because it's not only that this person came and sought help, but as well as he chose to even continue helping others, which is very beautiful.
Yes.
Absolutely, absolutely. And also, one of the first topics we do have is STD prevention. Like we just heard you talk about sexual health. What are some ways that in the context of harm reduction that we could talk about STD prevention?
Well, harm reduction in and of itself is what the words say, right? So it is an effort to do intentional work around reducing the risk of a person harming themselves and the people around them. So their community, their family, the people they're connected to. I always call them circles of love.
I like that.
When we think about STD, right? Again, like substance use, a lot of people go straight for the substance, stop using it, stop having sex, right? Ours is more of a curiosity. And we use a 3-pillar approach, which is engage, educate, and empower.
Amazing.
Right?
Yes.
We engage people when it comes to STDs is not to say we are aware of their sexual behavior. We learn about their sexual behavior. We learn through conversation. Like we offer resources like condoms, like the sexual behavior, right? I can't assume that you know what exists out there. So when we use the 3 pillars, I'm learning, I'm talking to someone. So you're probably wondering, how you talking about sex, right? It's interesting. Just to throw out here for your audience.
Right.
You remember when we first met with you and Farhan?
I think so, yeah.
Okay. And me and my colleague Takesha with Target 4, we asked the questions, is it okay for us women to go talk to men in the Somalian community about sex and about putting condoms on a dildo? Like, how do we have this conversation? So it's doing that. It's literally asking, so what makes you comfortable talking about sex? When I see people blush, I'm a clinician. So I'm already like, I know people are going to be bashful. But it's asking people and learning about their behaviors.
Absolutely.
Then I can educate and say, well, this is what we have. For instance, I remember working, this was really before my career in harm reduction, when I was practicing and didn't know what I was doing. It was harm reduction. I had a young lady who was coming into my sessions as a clinician, as an alcohol and drug counselor, and she was using the Plan B regularly.
What?
Yeah, she was like, always needing Plan. Are you allergic to Plan B? Every time I say every time I say it, start coughing. I'm like,
it's not me. It's really. I think that word got something in my body.
It's something in your body about.
It's traumatic a little bit.
It is. Are we having some like?
It's that traumatic flashbacks you get from the words.
See, and I'm like, Abdi, has there been women who needed to use the Plan B? Like you. Okay, but anyway, she was using them regularly, right? Mm-hmm. So I started pivoting my conversation like, hey, what's going on? Like, and what it came down to was her having a tough time having a conversation with her gynecologist about birth control options, right? She told me about the ones she didn't like, and it was only a couple of them. And then I was like, wait a minute, there are so many different types of birth control. So we had this conversation about different birth controls. So I'm like, there's a potential negative consequence, harm reduction, right? With you continuing to do this to your body, which Plan B, what it does is it allows the breakdown so that this the egg does not form or continue to grow. So it's forcing your body to dispel it. And I'm like, is this going to be healthy long term? I'm not a medical provider. None of us, unless we are MDs in this work, are medical providers. But what we do is Think about long-term use of any pill, any medication. If I were to ask you, Abdi, why do you take Tylenol every day?
Maybe I go to sleep late every day and my head hurts.
Your head hurts, right? So, but see, because we talk harm reduction, right? But maybe you're just like, my head hurts, right? That would be your first response. Yeah. And I say, well, when does your head hurt? Like, how often does it hurt? And you'll tell me, well, I go to bed at 3 a.m, then I get up at 7. And every day I do this. And I'm like, wow, you don't get a lot of sleep. And then you're like, well, I do drink coffee to stay up. So I'm like, oh, caffeine. So you're going through caffeine withdrawals at some point during the day. Now my next thing is, have you ever considered drinking a little bit more water? How much water do you drink? Because I'm concerned that you're putting Tylenol in your body every day. So when it comes to sexual health, we don't focus so much on STDs, or STIs, which is what people think. We focus more on your behaviors. We focus more on what is happening with you. When I work with women who are sex workers, empowering conversations after we engage our women who work in this industry, right? And we ask them, about testing. Have you ever been tested for STDs? A lot of people in the sex industry, they automatically say yes. And you know what test they're thinking of? HIV/AIDS, right? Yeah. HIV, thinking about hepatitis. And so now it's an education opportunity. It's like, hey, did you know there are so many others that, depending on what you're doing and what resources you don't have available to you, you're putting yourself at potential risk of contracting. And now the conversation becomes more engaging because I'm like talking about it. But it starts with, hey, who are you? STI and STD prevention is very difficult, as you know, culturally.
Absolutely.
How do we have the conversation with cultures? Similarly, in the Somalian community, and you can share with me, I believe you guys shared with us the thoughts around sex, but in the Black community, now I'm talking about Black Americans here, a lot of education didn't happen in the homes of Black families due to religion, Christianity, sex being taboo, even though it's a beautiful thing. And all of us, everybody that's here and came from sex, right?
Absolutely.
So that's a similarity of how is the conversation at home with people and around sex. Before we can talk about the infections and infectious disease, we have to be able to have open conversations about sex. The other layer is not a lot of places, again, thinking about the community, same sex, sexual activity, same gender. People don't know, which is why I'm like, we have to talk a lot about sex before we can get to STIs. I've sat in a group with young women, Bea, Beautiful As You Are, an organization that has a brick and mortar in Indiana. And this will be my last thing so you can move on.
No, you're good.
But the women, it was a young girls group they had an event called Cupcakes and Condoms. And I remember sitting there and they were talking about using protection when you're having sex with boys, young men. And I saw about 5 or 6 girls pick up their phone and go, well, she ain't talking about me. And I was like, wow. And I just watched it because the conversation got riveting. It was engaging because these girls like, oh my God, I have to put a condom on. Yeah, ladies, you have to do this. And I raised my hand and I said, sexually transmitted diseases and infections can be transferred amongst girls engaging in sexual activities with girls. And all you saw was the phone, right? Phone went down, like, how? Right? And I was like, so I looked at the facilitator and said, we have to remember, right? Even if it's not your belief, even if you do not care to engage in this behavior, even if you're against it, it doesn't mean it doesn't exist. And if we're talking about highly transmittable infections like herpes simplex virus that doesn't really show itself a lot, right? And we're talking about 80% of the population having this in their body, even if they don't show symptoms of it, but they have contracted either the HSV1 or 2, which HSV1 is oral, HSV2 is in our genital area. So I'm like,
So I have a question, just for our viewers, just so they can really get understanding. You said oral, so that means if someone kisses another individual with X, Y, and Z.
The potential. But the thing is, and this is why we encourage people to talk to their providers, right? How does that happen, right? If someone has an open wound in their mouth and you don't know it, and you don't know if that open wound was from them biting themselves, because I have an overbite, so I bite the hell out of my lips, or if it's a cold sore. And is it a cold sore from a blister, or did this person bust their lip? And you continue to engage the potential and the likeliness of you transmitting. I can't confirm whether, again, disclaimer, not a doctor, I don't get paid that much.
Amen.
But the idea that, yes, there is potential risk to knowing that if you engage in saliva to saliva exchange, which you'll hear exchanging fluids, there's a potential risk to contract anything. I mean, think about it. If I have a cold and I kiss you, the potential of you getting a cold from me, right? Or if I have the flu, right? If I'm sick, and I decide to kiss my partner while I'm sick, so it's the same idea. But that kind of brings down the stigma of it, doesn't it? When we say, listen, it's a part of the fact that we lack education from decades, not now. The reason why we have so many people that have an infectious disease like this is because a virus like this is because we lack the ability to have these conversations early on how to protect ourselves, on how to identify if I do have something, or if I had a sore, do I go to the doctor and let them examine the sore, or did it heal up? And I was like, okay. So yes, there's a potential for transferring that.
Absolutely.
Orally from mouth to mouth. Thank you for asking.
100%. And this goes to one of my exercises I would like to do today, where we do the myth and facts. Yeah. So one myth I was going to ask was, does kissing another individual transmit STD virus? What you just told us absolutely does.
Yeah, it can. It's the risk.
Absolutely.
And that's why we practice harm reduction prevention, right? And talking about it.
Another myth and fact I have for you is, majority of our viewers are married. Would you say regular testing for married people is recommended?
Yes. So a lot of people are like, wait a minute, and they may look at their husband or their wife like, hold up.
Yeah.
This is the thing. I remember I had a friend who found out they have HSV, right? I have quite a few friends that are finding this out. And when they talked about their follow-up with their doctor, and they were blown away because their doctor was like, listen, this person had sex at the age of 15. They were like, you could have contracted this back at 15. They never had an outbreak, never seen it. But through a blood test, they discovered that it was in their blood.
Wow. So HSV is asymptomatic, so it doesn't show symptoms.
It can. HSV can, and that's herpes simplex virus for those who are watching. It can be dormant, it can lie dormant in folks' bodies. So I say that to say, is it possible that a married couple today that's been married for 20 years, that if they decided, let's go get tested, and one or the both of them end up showing positive, it does not indicate that someone is cheating or infidelity exists. It doesn't.
Absolutely.
Because unfortunately, a lot of medical providers are not testing for that regularly.
Wait, hold on. This is perfect. So medical providers don't test for other STDs, or do they just go for the main basic big four? So
my recent doctor's appointment, I asked to be tested because I want it, and I'll be following up, but I'm like, I had to ask for more testing and to make sure. And I know my nurse practitioner, her response was that this is one of the tests she don't like to use because so many people are positive and then they freak out. Because now they're ready to point a finger like, you did this to me or this person. And she's like, most of the population has this. I don't think that's, and personally, I'm gonna be honest, I don't think the approach is don't test people. I think more people need to know. The reason why is because just in case, right? With anything, if I have more information, then I know how to move in the world, right?
Absolutely.
If I want to do something, now I'm empowered with information and I know how to move accordingly and not put someone else at risk. There are autoimmune disorders that if a person comes in contact with particular STIs, it can hurt them a little bit more. Or if someone is HIV positive, their immune system is already compromised. So when I worked in HIV care primarily, a lot of my people were undetectable, which is great. And undetectable means, just for the audience, that individuals who have a low amount of viral load in their system, when they are tested, when their blood work is done, it is so low that it's not detected. It does not mean they do not have HIV. It's just at such a low amount that the risk of transmission is down to 0. Mm-hmm. So that means that a person does not have to transmit. The other piece to this, though, is if someone's sexual activity is unhealthy and they're not taking care of themselves by lowering the risk of their behavior and applying some harm reduction resources, and they are positive, because their immune system is compromised, it can harm them a lot more. Their outbreak could be more serious. It could be more intense. It could be more painful. Any other illness can show up and be a little bit more intense because of their immune system. So, and how much it has to fight. So I used to tell my clients, you don't want to add anything else to your plate, right?
Yeah.
You don't want your blood pressure to be high where you have to take a blood pressure pill. It wasn't just STIs, it was everything. You don't want to have your A1C, which is diabetes. You don't want that high. So let's do this. So when we're thinking about people with compromised immune systems, people who are going through cancer treatment, right, and they're in remission, you want to be careful. So that's why talking about sex helps open up the discussion about STIs. People hear stigma. When you hear STIs, like, I'm nasty, right? It's the stigma we push. There's nothing nasty about becoming infected. I mean, I don't get a cold and go, I'm just nasty, I'm awful. No, it's okay. What behaviors can I improve now that I'm aware that my behaviors may have led to some things? Yeah, these consequences, but they're manageable.
Absolutely.
So I'm glad we're talking about it, because married couples, as we know, HIV infection rate seems to be a little bit higher with women, and especially women of color. And a lot of it has to do with us not knowing that we still have a right to protect ourselves in our marriages. And it's a difficult conversation. I always recommend that people find a good therapist.
Absolutely.
A good family counselor. In the Somalian community, you guys do an amazing job. I think they need to all be here talking to you all, because you're so connected and engaged, and you can help them have that conversation with their physician to protect themselves. And so, yes, testing, absolutely. If you're continuing to engage in sex, I used to do a meetup with women, like Sister Chat. Mm-hmm. And my first one I talked about being tested through my marriage. I'm divorced now. I stayed getting tested. I empowered women and said I knew what my marriage meant and what it was like. I didn't have to lie to myself.
Absolutely.
I felt empowered to know that I can protect myself because I was staying in this marriage. And that's empowering for women who may feel like this marriage is a lot of my life, and to leave it would be harmful to me. So if you're going to stay somewhere and you're aware that there could be potential risk and harm happening, there's a way to protect yourself. And I and my colleagues, Alicia and Takesha, are open to actually having conversations. So if you have women that are interested in talking outside of anyone being connected, we are open to that.
Absolutely. And for our audience, our women's audience, we will put Sharita's information right here. So you can always email her, call her, get in contact with her. She's amazing. And she's always here for our community all the time. Amazing. But we just want to thank you all the time. You know what I mean?
I know. I'm a part of the smiling community.
Absolutely.
I think my lineage.
A little bit of Somali in there somewhere.
You know it's in there somewhere. But yeah, we are open to that. I'm definitely about women feeling like they have a space to figure it out, and no judgment, right? That's the harm reduction.
Absolutely. And usually a lot of times one of the biggest stigmas with the Somali community in general is a lot of the Somalis are very afraid that maybe there's confidential reasons, you know what I mean? And maybe they'd be shameful in the community. Maybe they'll bring shame to their family.
Yeah.
And all these things are hindering them from getting better help.
Yeah.
Which is not harm reduction, because you're putting yourself in a situation where maybe you're belittling yourself.
Yeah.
Maybe you think if you go and ask for X, Y, and Z help, nobody wants to. But we are really here for that. And we really, really encourage you guys, if anyone, we have full confidentiality. We follow HIPAA laws. We are not here to belittle anyone. We are here to simply meet you where you are and try to see how we can move forward from that, and hopefully to live a better life and be self-sufficient. That's really the goal. Absolutely. I love that. And on to our next topic, which is substance use, which is another key topic in our community. They just jump back to back. But substance use, I've seen it personally with my own eyes, especially with like close friends, maybe even some relatives and a lot of times with our community, when it comes to substance abuse, maybe our other folks, they always run to the thought of, if this person just detox, they'll be fine. What do you have to say about that?
That's part of it. Detoxing, if you think about detoxing in its basic terms, right? You all have a practice where you detox. You do through your religious practice, you fast, right? Okay. So the way that I understand fasting for me, when I fast in my spiritual practices, I'm a Christian, not the Christian that is running this America, but I'm a Christian. I don't know what kind of Christian they are. I look at my fast as a detox. Okay. I step away and pull away from things that are a little toxic in my life, distracting. It's a barrier between me and the Creator, Allah, God. It creates a tension sometimes. So those things in my life that are creating a harm that's sometimes unintentional, I remove it from me for a period of time, right?
Absolutely, yeah.
That's detoxing. Detoxing is a part of it, though, because would you say that fasting is it? Like, as long as you fast, then you're a great,
great Muslim.
Great Muslim. You are a great Muslim because you fasted. That's it. That's all you have to do, right?
Nah, you got a couple more pillars.
There you go, right? So it's a part of a whole.
Absolutely.
So when it is a false narrative to think that detoxing only cures it. Detoxing allows the mind, the spirit, the alignment of the body. Like, think about it as fasting. It allows me now to be clear, right? So I indulge in alcohol, right? When I am trying to make some very clear decisions, like big decisions, on weekends when I would normally like kick back with my friends in my circle of love, I might say, you know what? I'm going to pray at these different times, and I'm going to fast from alcohol for the next 72 hours. What I'm doing now is allowing my head space and my spirit space and my my body. I'm allowing myself to get very centered and grounded with intention. So I'm adding in some practical steps, which if we look at the continuum of care, detox begins it. Now I'm going to bring in some care, some practice, which would be the treatment. It would be recovery. It would be what harm reduction activities do I need to add into my life if I'm not abstaining completely from substances? All. It's starting to take a deeper dive into who you are when we're talking about transformational healing. So yeah, I don't negate detox. I think that it's imperative that we pull away that thing so we can see what it really looks like, what the craving looks like. Detox in the substance use piece allows people to become detached from the substance, from their body. So it's like taking a substance, putting it there, and your body now saying, whoa, this is how it feels without it. I'm shaking. My body, it feels like it's not in control. Oh my gosh, I'm having somatic issues. I'm vomiting. My body doesn't know how to react without it. I'm having weird or thoughts that don't align with me. That's different. So you're starting to notice all the things in your body that alcohol or drugs or any other mood or mind altering substance has kind of covered up, kept quiet. That's kind of made it disappear. And so all these things kind of flood to the front. Detox can be hard. That's why sometimes we have spaces like treatment centers. We have spaces like safe spaces in people's homes. Some people use their homes as a detox space. We have healing and transformation spaces. These spaces they're imperative because they create a safety for a person to detox or allow themselves to truly release whatever toxic thing that's in their body that's causing harm.
Absolutely. I like that. So, yeah, detox is a key method to get to the first step.
Yeah.
Basically, if you get rid of all that toxin in your body, now you have the ability to think clearly, to move freely without any restraints in your mental capacity, which is amazing. And a lot of times, when it comes to the Somali community, we are one. Like you've seen us before. We're a village. We work together a lot of times. But a lot of times when it comes down to like our people who do use substance abuse or overly use it, maybe it kind of gets to a point for them where they are seen like they believe they can't even walk inside the mosque because they'll be looked in a different way. Like maybe if somebody smelled like a little bit of weed and he came to the mosque, automatically he's the devil of the place. So all these small little
Well, it's the devil's lettuce, ain't it?
Indeed is. But you know what I mean?
Right.
All these things, because at the end of the day, there is a core reason for this person to be in the situation that he is. And I always believe that meeting that person where they are, and if it's them walking in the mosque, smelling like that, I guess that's where I got to take them to meet them. So those attributes is kind of where majority of the Somalians kind of lose the faith in them, I guess.
I think it's a good space. I think this would be great to unpack. So when I envision someone walking into this temple, into this sacred space, right?
Absolutely.
So I'm thinking about the leaders and the people who create this space and what this means to them. And when I think about how do I support a community like the Somalian religious community, Muslim community, how do I support them in meeting their people where they're at? The first thing I do is unpack what is it that's the concern from people, right? When anyone tells me that, no, I don't want this here, that can't. So my first thing is tell me about that, right? What's the concern? So could you share what you may have heard is the concern if someone comes in and they smell like marijuana? What are some of the big responses that you would get?
We'll get they'll harm our kids, or maybe there'll be a bad influence, or maybe this person has another agenda that they don't know about. And it's always a misconception and never they don't ask the person, why are you here? What do you need from us?
Right.
It's more so, what are you doing here?
Right. So I always tell people when they tell me stuff like, I'm like, okay, so check your assumptions. It is nothing wrong with asking questions, right? I find it very interesting in the dynamics, like even with my kids, my adult children, like, or people I know, partners that I've been with, right? I ask a lot of questions, right? And they're like, well, why would you ask me where did I go on Friday? I said, I'm checking my assumption. You want me to check my assumption. You don't want me to assume, because the other side of this is now I get to think and create the narrative on my own. And I'm a creative, so I can create all kind of narratives, right? And they will fit, they look good, they smell good. It is what it is. But checking the assumption. So when someone says, I'm afraid someone can harm my kids. So what I do is I ask a question. So tell me a time where someone who smelled like marijuana harmed a youth. And what it does is it makes people tell me their story, because there may have been someone that got harmed, right?
Absolutely.
And that makes sense. The other thing is not knowing what a person's motive is. Leaning into that, hey, you came in today. I'm curious, what's your intent today? There's nothing wrong with asking someone that. Hey, what's going on? Why are you here today? What brought you in?
What made you come into these rooms today?
Yeah. What made you come in today? Because you may find that person's like, yeah, I want to stop this thing I do, and I felt like the only place to come is here. Or I want to be one with Allah. I want to be in this space. Okay. The next thing is to unpack people's misconceptions about what these substances do. So when people smell weed, it's usually educating people on what this mood and mind altering substance
I heard some stories where people, you'll hear Somali moms be like, oh, he smells like weed, he's mentally ill. Like, they'll throw
But both of those things can be true, right?
Yeah.
It could be, right? Like, when and with a statement like that, oh, he smells like this, he has mental illness. And it's like, cool. Questions. What other signs have you seen that there's possible mental illness? And people might say, I noticed that he's in his room all the time. He stays away from people, right? And I'll be like, well, when did that start? See how we're moving away from the weed? Like, it just, because now I'm going to the person, and that is the engaging piece. Because now I'm like, the weed, the substance, the actual substance itself, the use of it, that's a symptom. There is something else. There's something. You're right. Like, okay, cool. So you know that there's something. But how do we get to finding out the something so that we can understand a relationship to that substance? And sometimes when we're looking at youth use and their exploratory use, there is something. There's a reason. And not all of it is around peer pressure. It's more about peer community. What I've realized is we call it pressure. But when I really reflect on what we're looking at when we look at substance use, it's no different than adults, is that this is a community that these youth are part of. What communities do they belong to outside of this one? And within this community, what else do they have access to? So it's deeper than the drugs, right? I tell people that's a symptom. That's a symptom of something else. And when we look at our communities and say, I'm more curious, I'm going to lean into curiosity and see, you actually start to pull people in more versus I'm going to push you away because I just don't agree with it. I don't understand it. That's a better way to look at it. And that's the language I offer people as a gift, is instead of me walking away from you saying that you don't agree, it just simply sounds like you don't understand. And it actually helps soften a person and say, right, I don't. Good. Do you have? What keeps you up at night around substance use? Is it messaging? Are you seeing a lot of people overdose in your community? Does it scare you? Do you feel like someone's going to overdose in the mosque? Do you know what to do if that happens? Because it could. Did you know that a person doesn't have to smell like or look like anything, but absolutely be under the influence of a substance? That someone sitting right next to you right now could be high as Cooter Brown. They could be extremely under the influence and you would never know. How do you connect with people like that? And that helps a person realize how harm reduction works. Again, engage, educate, and empower. You know, it's okay to acknowledge your fear. What are you going to do with it? You know,
I like that.
And how are we, if the goal, like I tell Christians and in the churches, when I'm talking to the leaders, if you look around, how many youth are really involved? Are they falling away? Because is the church going to die when you die? Because that doesn't sound like being a good shepherd of your flock. So what are we missing? And that non-judgmental piece. Now, don't get me wrong. Under religious ethics and under religious followings, which is a system, yes, I get it. There are just things that won't be tolerated. There is the higher power in these religious organizations, these religious spaces that seems to look at whether you're guilty or you're not. And if that is the approach, then allow people to get to know that higher power. Like, these are all opportunities to connect. So if indeed what this individual is doing is not okay and you believe in the power of Allah and the teaching, then teach them. And they'll become convicted and they will see the errors in their ways. But you have to be able to teach.
Absolutely. I like that.
You
Absolutely.
know?
And usually a lot of times it's really that initial step of stepping in and saying, I'm there for you. You know what I mean? It's really that's
I'm
all.
there.
And a lot of times if you receive the education or you understand, it's not as hard to give it out anymore or to give it to a person, because now it's more so of, hey, I already learned this. I went to school. Okay, now when I teach it to my son or maybe somebody else, it won't come out as like when I was learning. It'll be way more easier. It'll be more understanding with experience, with time. All these things kind of put it together. You kind of can give back to your community in a way. And majority of the times, I guess, we just need to kind of help our community with more psychoeducation. So I love the fact that we're doing these podcasts.
I do too.
I swear.
This is amazing.
It helps a lot. You know what I mean? And then, which with these three topics, it's always amazing because they kind of trickle
down. They do.
To one
I love it.
So now we have the mental health part. What is somebody's mental state as they go through either STDs or substance abuse? What are some things that might be going through heads, or how could they feel, or you know what I mean? Trying to get into that person's persona. Like, what's their perspective on life? Like, kind of give the audience what you see in people's day-to-day, you could say.
You know, navigating our mental health, and I want to really lean into the fact that if anyone was alive in 2020 when the world just shut down, and the fear around being around people, wearing masks, the fear, the intense push of fear, we are all living through our own form of post-traumatic stress disorder. We have youth that went through school, a whole year or two of school, away from people, from fear. All we got was death on the news, talking about it. These many people died. Images. And we still struggle with making sense out of good mental health care. There's still barriers. So I want to like really sit and bring in the reality that all of us have experienced some traumas, losing family members and friends because of our own beliefs. Some people in your family absolutely did not want to get this shot, this vaccine, and then you got people who did, and people stopped talking and split. You have so much that we don't even have to go back before that. We can start at 2020. And then trying to navigate untreated mental health symptoms that we're not very sure about, because no one really talks about that, while also addressing healthy engagement in relationships to avoid sexually transmitted diseases, infections, and limit chaotic substance use. That's a whole hell of a lot to put on a person.
Absolutely is.
To think that we live in a world where we're thrown so much information that is drastic, that's traumatic, not just within our communities, but within our families and what's happening in our homes. And to tell people that you're bad because you drink or you smoke weed or you use cocaine, and not simply sit with the fact that people are just trying to manage day to day. I read a quote on social media, and I shared it, and it was a simple quote of, "No, remember this, people don't fake. People fake happiness. They don't fake depression."
Oh, whoa.
People fake happiness. They don't fake depression. When we sit down and really think about how often, even myself, and I reflect on how often I smile, and someone see me and, hey, was I really feeling that way? Did I just get off of a call, an intense argument or breakup or something? Are people really asking me when they say, hey, how you doing today? Are they asking me what just happened about 20 minutes ago? Or do I just go, everything's good? There's a lot of us going, everything's good. And we're like 2.5 seconds from leaving this earth.
Yeah, you haven't told a single lie right there.
Right?
I get that. I'm fine. I'm okay. Life is life. You know what I mean?
Like, what do you do? What do you do with that? So when I think about mental health and the state of mental health right now in America, we are in a crisis that no one talks about. The beginning of the year, this year, there was a report that came out. It's in news. First couple of months, I think we had 40 completed suicides. That was Jefferson County report. Mm-hmm. Not sure if it was the state of Kentucky, but you can research it, Google it. But I remember looking at that like,
the year just started.
One is right. The first couple of months of the year, one is too many. But to think that there's 40 people, that there were people who said, I simply can't. And we're not looking at this as a crisis. We don't see this as a pandemic in itself. This is an epidemic. We don't see the youth out here fighting, killing, the increase in violence among youth. We don't see that, or substance use amongst youth. If adults are, and I'm gonna use this word for our youth, if adults are tripping, what do you think a youth is doing? Like, I'm like, they don't even have the development.
They got a word for what the youth are doing now. It's called crashing out.
They're crashing out, right?
Crashing out.
I'm sitting here like, they don't even have the development of an adult yet, the emotional development that a lot of adults still don't have, right? Absolutely. The emotional stability. And you expect youth to operate at a mature level? Absolutely not. We are in a mental health crisis. And until we can really embrace that, all of us are just spinning our wheels. Mental health care through Medicaid is horrendous. The barriers that people go through trying to get appointments, the health care and the actual allocations of funds, and the way mental health care is set up for a lot of these, the Medicaid, what are they called?
Community-based services?
Yeah, but like how many sessions you get approved for, and who can go into inpatient treatment. I was looking for a lower insurance for my organization, for myself, and I found one that was really low, really good. I mean, I was excited. And the questions they asked me, which ended up ruling me out, they asked me about my psychiatric diagnosis. I have ADHD and anxiety, y'all, just letting you know. But they asked me about that. They asked me whether I had a hysterectomy or not, and didn't have my uterus. And I'm gonna tell you all that the reason why these questions were asked. If I hadn't had a hysterectomy, I would have been disqualified for that because they did not support the birth. I would have had to pay that out of pocket. Yes, labor and delivery costs. I would have paid for that. As far as psychiatric illnesses and mental health, this is the kicker. That insurance would approve of outpatient services, not residential treatment. And I only had so many units that I would be able to use for outpatient mental health. And if I needed substance use disorder residential treatment, I would have to pay out of pocket. And so I'm sitting here like, okay, we have, especially in the state of Kentucky, we have this Safer Kentucky and this Better Without Them from the AG's office, Safer Kentucky from the governor's office. We have all of these ideas around being healthier, but it's not matching when it comes to what the options, right? The offering of the services.
Absolutely.
So I'm just like, we got some real concern, and I know that organizations like you all's and ours are attempting to meet people where they're at and be the gap filler. But I'm largely concerned that if we continue to see cuts in funding and Medicaid, that we're going to see more devastation like we did in the beginning of the year.
Wow. So due to the fact that we're not getting the proper etiquettes for Medicare, it's causing a decrease in diaspora health.
Yeah.
Is bad. That is
and
bad.
How do we get people who culturally struggle with asking for help to ask for help when they could be turned away?
And a lot of times, I remember, I don't remember exactly, but I remember reading or I listened to, it was a guy talking about how he was willing to ask for help, and when he did, the doors got shut on him.
Mm-hmm.
And the second time he wanted to go, but it was that fear of being shut out again. And he actually died from suicide.
Mm-hmm.
So it was due to Medicaid not helping him, he committed suicide. So a lot of times, wow, that is very sad.
And sometimes what I tell people is that comment, that quote you said, if he smelled like weed, he has mental health issues. It's quite possible.
Yeah. Absolutely.
Right? When we look at harm reduction, we look at the fact that some people are self-medicating because they don't have access or don't trust the system at this point.
Absolutely.
You know, and so self-medication is the way that's keeping them going until we can get them to a place. We meet them where they're at, and then we don't leave them.
Absolutely.
We walk with them.
I like that. One of the questions I also have around this topic is, a lot of times we have cases where our mothers, or we have teenagers, whether it's a female or a male, and the mothers won't know how to dialogue with them or
Mm-hmm.
kind of get into that headspace. What would you say to our women audience, our mothers out there? How could they communicate with their loved ones? How could they share their concerns? You know what I mean? Because a lot of times they're coming from a good place in heart.
Yeah.
So I just want them to know that we're also here for them and trying to help them understand.
Absolutely. I have 3 kiddos in my life that I've raised. So my 2 biological children, my son just turned 19 and my daughter is turning 24 this summer. And my bonus daughter up in Chicago, she'll be turning 22. I didn't always get it right. When they were younger, I remember our sex talk was me showing them very graphic pictures of all the illnesses and what it looks like to have herpes on your penis and your vagina, on your lips. Me and their dad, we did the straight war on drugs, failed concept of fear, right?
Traumatizing them.
Traumatized the hell out of my kids. So just to share with you, we don't always get it right. When we know better, we do better. So as my youth started growing up, and it took me going to my own therapy session and unpacking my concerns. So it started with me, started with my discomfort and with my fear. Remember, I work in the field where I'm seeing it all. So it came from a good place. Like, I know where this is going to go. Am I being effective though? Is this going to work? No, it's not. What I found to work was to lean into who I was at the ages that they started exploring. This is where it gets difficult for parents. A lot of parents teach from the lens of, you don't do what I do, you do what I say. Growing up and going through puberty and being a youth, I can remember how I felt. I can remember wanting a boyfriend. I can remember my heartbreak. I can remember the first time I did have sex. I can remember what my little sister, my baby sister told me. And when I sat and I said, I'm going to own my experience, because my experience as a lived experience can help my youth make better decisions, engage and educate and empower. I'm not assuming, but because I'm aware of what's going on at this age of adolescence and the fear and the awkwardness and not wanting to talk about it, now I can lean in even more and create the space. So it was uncomfortable. But I remember having a conversation with my daughter as a teenager, and I saw her phone. And the conversation she was having with her boyfriend, my goodness, I was like, I didn't know you knew how to do these things and say these things. And then I was like, oh my God, what is she doing? So instead of ignoring it, I came to her and I said, hey, I want to really have a conversation that's going to help. And it's going to be awkward. But I want to talk about birth control. And she jumps back like, I'm not doing anything. And I said, okay, you don't have to be. But let's go talk to the doctor, because she's going to share options. If you're having conversations about it, that means you're thinking about it. And that's okay. See, that's the part I had to do. I'm like, okay, I was talking about it before I actually did it. And I lied when I was in elementary school and said I was doing stuff that I wasn't even doing yet. So and I shared that with my daughter. I shared one of my experiences that, yeah, I get it. You want to talk about it, but it can lead, because curiosity says, I want to actually try this. And no, I would love for you to wait until you can deal with potential heartbreak, because allowing someone to enter your body is such a precious thing. This conversation was very long. And no, she didn't like it. She didn't like it. But you know what's cool about starting these conversations with my daughter like that? She stayed on birth control and then she came off. But about a year ago, she came to me and she was like, I'm going, to my appointment. And I was like, cool. And when she came back, she was like, oh, I got back on birth control. Now my daughter's grown. She want to have a kid right now, that's on her. I'm not the grandmama to start stepping in and doing stuff either.
You ain't take care of no grandbabies right now.
No, I'm still young. And I said, what? She was like, I do not want to do that right now. And I said, oh my gosh, it worked. What we're doing is giving them the tools, education. If you know that you was looking at boys or girls and at 12, at 10, why ignore that these are the thoughts that are happening at that age? Why ignore it? if you don't see evidence, I always recommend start the conversation. Is there anybody you like? And so with my son, he was different. He didn't want to talk to nobody. He said, I don't want a girlfriend. They act weird. They're strange. He didn't want a girlfriend because he saw how girls acted. He didn't understand why they was laughing and pointing at him. Somehow, are you going to go to the dance, Malik? And he was like, why are they laughing at me? I don't understand. I was like, they kind of like you, right? So he was different, right?
Absolutely.
And so I'm having this conversation like, it's okay to like someone or think they're cute. Is there anyone you think is cute? It's like, nah. I'm like, do you look at them for a long time? I mean, yeah. Like, having the open conversation allows them to be more free. Fast forward, as a young man, I learned that he did lose his virginity. I know my kids like, don't ever show them this. But what I felt so good about was he went to his first appointment on his own for his doctor. And we were talking about something. I was talking about guy stuff because I'm not a guy. And I'm like, can you tell the difference between jock itch and it being something else that you done got from sex? I'll talk like that. And he's like, yeah. And when I went to the doctor, I had them test me for everything. And I was like,
proud mother.
And that's kind of how I got the clue that maybe this happened. But I didn't harp on it. But I was sitting here like, that's what the outcome is. The outcome is your youth make better choices about their sexual behavior. They may ultimately wait until they're married. The other thing is, when I talked about sex and protection, I didn't make a difference. My children are attracted to opposite genders. So my daughter is attracted to young men. My son is attracted to women, young women. But the way that I talked about sex it was across the board. I didn't tell my daughter she needs to save herself and for the special moment and not share that same emphasis with my son. I made sure both of them knew how special that is and how that moment should be tailored and how privileged a person should feel to lay in the bed with you. And not everyone needs to put their mouth on you. And if you're going to stick your penis in a hole, you need to have a condom on. See how that's heard versus with a woman. I don't know what my child might decide to do, but what I don't want to happen is my child explores in some behavior that whether I agree with it or not. And now we have to have a tough discussion because now they've contracted something doing a risky behavior that I just assumed they would never do. So when I talk, I speak in a general way that embraces all of them. So they all know how special that moment is special. And when you lay down with someone and you exchange your life with them, it can last with you when you take that person with you. And so you have to make a decision. Is this someone I want to carry over the next 20 years? Because there are bodies that I wish I could have just erased from my life. And that's how I talk to them. Like, there are people I was like, oh my God, I made a whole mistake. You have an opportunity not to make the same mistake. Doesn't that conversation sound like, wow, that sounds better than let's do sex 101.
Yeah.
Let's talk about STDs. It opens the door for those conversations.
It also kind of, when you build it off that way, it kind of builds that bond and that trust. So when something does happen, they know they can kind of come to you and also ask your assistance or maybe even some more advice. Maybe they might even ask directly, maybe indirectly.
Yes.
So all these ways, it gives them an opportunity for them to lead their way.
And do it the same. These conversations can be tailored for all issues. So when we're talking about mental health concerns, we're talking about substance use. If you have a youth in your house and you smell them come in with weed, right? We don't ignore it and just say, oh my gosh, they're, doing something bad. And we pray and we have action with that prayer, right? The prayers that I prayed when my daughter was exploring substances, was give me the right words to say, right? How do I go into this so she can be open? I don't want her to shut down and shut out because the consequences of her pushing me away is that she can harm herself seriously. So what is my goal? And my goal is education. So engaging in conversations around substance use. The questions I ask my daughter, even now with a couple of her friends, and it actually changed the way they use alcohol, was I asked them, what's your relationship to the substance? And they were like, what? Nobody ever asked me that.
With that. What are you talking about? Relationship?
Right, relationship. And I said, well, you don't think you have a relationship? I'm like, let's talk about relationship, right? When you have this substance, what does it feel like? Why do you, and that's when they said, well, I feel more open. I feel like I can laugh more, or I can talk to people. I'm like, also, it makes you feel relaxed. Because that alcohol, it does lower your inhibitions. It allows you to do that. And a lot of people do use it. And the potential with you using it so young is that because your brain is developing, is that your brain does not get the opportunity to learn skills on how to relax yourself in those environments naturally without the need for a substance. So once you introduce it so early, when you introduce it early on, your brain becomes dependent on using this thing to create the outcome you want. Wouldn't it be fun if you can learn how to create that outcome without it? Have you tried it? And so now they're learning their relationship. When I taught my daughter, when I changed my relationship with alcohol, was I noticed if I'm not addressing an emotional anger. So there's two different types of angry. I say angry about community work, social justice. I can have something to drink on that. If I'm having an intimate partner issue, like with my partner, if I'm going through an issue like arguing and I'm hurt or I'm going through a breakup, I'm not going to drink alcohol. I said, because with alcohol, now I'm going to be this blubbering, crying, emotional wreck who can't do anything with their life. And I don't like the way I feel. I'm trying to avoid a feeling by putting something on that's going to allow the feeling just to spill over. I don't like that. But I had to understand my relationship to the substance. I had to understand why I like it. I like to enjoy, I like to celebrate, and it's a celebratory thing in my life. So I'm not getting that when I drink it in this way. And so watching my daughter navigate substance use in the same way, she wanted to study to get an A on her test, and she fasted. She listened to me. She actually listened to me, fasted from all her substance use. And she was so excited about her A. And I said, see what happens when you allow your body to detox. Sometimes you have to reset. It's all about relationship. So you can talk to your youth about that. Mental health, the last thing, when you're talking to youth about mental health, it's tricky because there's hormones playing into this. There's, for young girls, we have cycles. Our menstrual cycle does a lot. It wreaks havoc on our hormones. Now, I suspect in the Somalian community that the eating habits are much better than some of us Americanized folks. But yet, if you are getting animal product from America in the chemicals that we put in here, we're dealing with a lot of hormonal issues. So when you take that into account, yes, you may be seeing some depressive symptoms. Yes, you may see your child is isolating. Asking a child if they're depressed, sometimes my kids, they know, you feeling depressed? Do you need to go to the doctor? I'm like that at times. They also grew up with me, so they know what I'm talking about. But for homes that this is not a normal conversation, it's leaning into that curiosity. I've noticed, Abdi, that lately you come in the house and you want to be in a room. I want to ask if there's ever a time that you feel like you don't feel good about yourself. You don't feel what you, Abdi, feel normally to feel happy or to enjoy your life. I want you to feel like you can talk to me about it. Now, I got that from my son, the young man, puberty, and I was always thinking something was wrong with him. And finally, what I discovered worked was, I asked him, I was like, do you like me asking you, are you okay? Are you okay? Are you okay? He said, no, I do not like you asking me that all the time. I said, okay, how about this? Can we have an agreement? If ever at a time that you feel not okay with yourself, Can I trust that you will ask for help? The other part of that conversation is if this is new to families. Because I'm thinking about my family, which we have this.
So this would be new to families because majority of the times we don't even like talking about any mental
nothing
health. Like I grew up in a first generation household, and mental health was not really one of the key topics that one of the key topics that you would hear about from the family members. Like you might get asked, "Are you okay?" But after that, it's bills got to get paid. This got to happen. So everybody's really constantly moving at that fast pace of catching up with life. So a lot of times when it comes down to Somali households, feelings and recognition of feelings does not exist individuals, especially our adolescents, teens. They're not getting that proper, maybe like you said, are you gonna go get help if you need help? Like getting that trust within themselves from their parents. I've noticed with the teens that I've worked with that doesn't happen very often, and they might go look for it elsewhere, like maybe within a friend group or whatnot. And usually, especially like in a men's settings of a friend group, you'll get the opposite. You'll get maybe a little bit of more people making fun of you or this and that. So a lot of times when it comes down to like the Somali household, you're in it where you're, I don't want to say thrown in the wolves, but alongside of you got to figure it out.
So the cool thing about you, and think about yourself and myself, is we're resilient.
Absolutely.
You know, birds, don't they kick the babies out the nest? Like, go figure it out. So in a sense, you all still have a leveraging point. The families don't have to. And what I think about is my work when I worked with in transitional case management, which were youth who were systems youth in Chicago. And really their household was not where they were going to get what they need. They weren't going to get their needs met. So it's how to build resilience in youth when they don't get it in a home base, at home. And you all have the platform. You have the teen groups. Teaching youth how to seek out support is going to be pivotal. How to use the younger generation of folks who work in this space as the allies, as the people who are supportive, to help them have conversations, healthy conversations around what's happening inside of their mind. Changing the language. Mental health, even though it's used, it's stigmatizing and it may not be accepted, but teaching youth how to communicate with their family in a different way. Just because it's not a traditional thing doesn't mean it can't change. And so little techniques like teaching them how to say, I want to share my happy moment today at school. Go home and practice sharing with your mom what made you happy. And share that for about a week and see what happens. What we start to do is build a culture within the culture of how to heal, how to break generational curses. I'll call things generational curses. My family, we grew up with very Afrocentric values and militant. So there wasn't a lot of crying. There wasn't a lot of sitting back, feeling sorry for yourself. You got up and you got it together, which is where I parented from. But it hurt my kids. My kids, they didn't have a mom that picked them up and coddled and hugged them when they fell. I was more like, get it together. You got this. Go do it. You got it. Like, I'm that empowering, strong, but they needed a little bit more of the softer side of me. But the breaking of it now is me actively hugging my daughter, teaching her, because she's showing me through her behavior that this is weird and awkward. Why are you hugging me? Like, why? I'm like, because I love you and I'm trying this new thing. Like, let's hug, you know? So it can be, I'm sharing that to say it can be done, and the youth are the ones that can do it. But it's going to be them introducing little things, you know? Like, I want to tell you what made me feel successful today. See how these feelings are coming out. And we start with the heightened feelings like joy, right? Happiness, success. Because what usually is happening in these cultures that have very strict dynamics of communication and feeling is that it's usually the hard feelings that are difficult to show. It's usually the hard ones that are difficult to deal with. It's not happiness. It's not joy. It's usually the ones, because there's a lack of what do we do with that. And if you think about people who's immigrant, they have an immigrant history or relocation, I'm thinking about it. Not that I've experienced, but I can only imagine that I have a consistent pain, point of contention of that I'm in an unknown place where I have a sense of sadness that's always going to be a residual. If you carry that for so long, if I carry it, I'm sure I'll look at everybody like, you know what, pull it together. You don't have time to be sad. You know how much sadness I carry around me, that I'm disconnected from my family. I'm a continents away. Like, can I imagine the deep, even, remember, people don't fake depression, they fake happiness. Am I truly seeing a happy person who has to work to support their family that is a whole nother day away? Like, it's even a different day in the country. Like, to me, I can't conceptualize that and completely understand, but I can have empathy. I can have a sense of, wow.
Absolutely. That
has to be so. Understanding that there is a group, communities of folks who have a deep disconnect, a sense of sadness, longing, a sense of hurt that others may not understand. Even people that look like you will not even understand. I can understand why. Because you might start talking about your sadness and I might have a whole breakdown. I might lose it. I might crash out myself because now my child is sad and I carry sadness and I can only understand. So maybe it's not a safe space to talk about the sadness, but to introduce the idea that I can share. I can share joy. I can share peace. I felt so peaceful today at school. You know what brought me peace? You know what brought me joy? Like, introducing the idea that they can help create that change and create a transformational environment so that they can see their parents as humans too.
Absolutely. I love that.
Yeah.
Wow. That was just amazing. I'm not gonna lie.
I think it's centering other people and what it could be. It's not that, and be really honest and transparent. I have no prior understanding. What I do in practice is I try to be as present as I can be in every space. And when you bring up something as personalized as this is your community, this is part of who you are as an individual, as a human, I allow myself to really try to step into those shoes of what it could be like. I don't understand. I will not understand. I can only imagine the heaviness because it feels heavy.
100%. You know, it's like you said. A person is a full day away from their family. Like, that is not. And then on top of that, some of the factors barriers is like, this person might not even be able to speak the language. Now he can't communicate with his taxi or Uber driver.
Oh my God!
Can't buy grocery at the grocery store like the normal person now because you feel.
Are you even normal? Right?
That's another thing. Are you
even normal? Like, you're in a world. I love this one commercial I saw on social media where it flipped everything. So they had nothing but wheelchair accessible things. I don't know if you've seen it. It was so cool. It was like nothing but wheelchair. The library was all Braille. It gave you the idea of what it feels like to be so different in a world where everything is built off of a supreme community of folks. Wow. This language is the standard. This religion is the standard. Everything, and then you're here. And you're here And it benefits that same country to have you here. Because let's not get it mistaken. There's agreements. That's why we have United Nations. That's why we have these different delegates and stuff, right? So there is a reason why there are groups here. They benefit from you but won't embrace you. That has to be all kinds of effed up. Like, and I'm Black. My ancestors are part of, you know, the slave trade. They have, I'm sure my lineage is from those pieces. I'm from the South. My family is from Birmingham, Alabama, and Mississippi. So I always imagine what this continued line of disconnection continues growing to the point where, you know, we don't know who we really are. So, but you do. And that's why I say that hurt has to hurt deeply, because you actually do. You know where you're from and you're not there. Like that's like, whoa. I can't imagine. But I can also feel it. So
I like that 100%. Usually a lot of times it's, I would say, very depressing for those families that first come on. We do a lot of case management work with resettlement agencies. So a lot of times when we're working with these clients, we always try to help them feel like it's a home. Like one of the things, I think it was Catholic Charities or IRC, what they do is they'll get you a plate of hot food from wherever you're from. It's like when you first arrive, you're hungry. But you don't want no McDonald's. You don't want no Taco Bell.
No, you want something that reminds you of home.
You want something you know. You want something that you eat and now you're full, you're replenished, you can go to sleep, start up. Because you're in a new world now. At least that is something that they do that I really like, and I just like to share. That. And a lot of times people kind of get the misconception that yes, these people are grateful to be here. You know what I mean? Either they're leaving a war-torn country or they're leaving for a better life. Now, they still need our help. Yeah. They still need our shoulder. You know what I mean? And that's what we're here for majority of the times. And a lot of times they have way bigger mental health problems that they don't even speak about, and they continue to go on. Like, for example, there's this one lady I do help with case management. She's lost her son back home while she's here. She has 5 kids total, lost 4 kids. Her only kid is in Uganda, somewhere in Africa. Oh, wow. And she really has no one to help her. Like, she doesn't speak the language. She had to fight through cancer. She can't see through one eye. Now, when people like that are here, it kind of makes me feel like I have a purpose to help these people. You know what I mean? And that's why I usually do this work, is because those type of people have no one. Like, truly have no one. Because sometimes you can feel like you have no one, but there might be somebody around the corner you can talk to. You just act like you can't talk to them. But there's people genuinely who don't have no one. Wow. And that is really the sad part about it all.
I'm going to tell you something afterwards that I want to do, and hopefully I can with you all's help, because I've been pulling and having a calling too. But I do, I'm just sitting with that. Right. I'm sitting with that. That is, it actually puts things into perspective. Like, especially when you said, people say I have no one, but there are really people who have no one. And that is, that's hard. It's hard to even imagine, right? Absolutely. Like, that's hard to imagine. I thought about a client of mine that I met when I was doing HIV work. And I think I told you about him. He told me his birthday was January 1 of the year that he was born. He said, but he really didn't know what his birthday was. Yeah.
So that's majority of Somali people.
Yes, he said it was just January 1. But he was in wars at 13.
Wow.
He was showing me like the gun, big guns, and I'm looking at him like, You know,
He's just 13 years old.
you were 13 when you, and he came over as a refugee here. And I never forget him. I always think about him because that was one of my first conversations with someone from, so there's a couple of communities. There's a Somalian community. Then I think there's another part of the Muslim community.
Muslims, MAC. We have MAC, Muslims Association Compassion.
And maybe he was Somali, but I feel like he said something else. So but it was my first like time engaging with him and just trying to imagine a life like that. Ain't no way. Ain't no way. No family, like blood family, like he has like family from foster, like,
but no family.
But no family. Like imagining not having that connection. Like I even think about people who I know who in foster care who are from here. They have opportunities to find out who their family is as they get older, right? They can look it up. But this individual,
there's no way.
I want to say that I believe he said that he believed his family was killed. But I'm like, what do you do with all that? What do you do with all of that? Right? So I say all this to say, I want families to give themselves grace that are watching this. Give yourself grace.
Absolutely.
You know, like grace. That's a lot to carry around. And the fact that you got up today and you're breathing right now, you're doing a really good job at living life.
Alhamdulillah. Indeed. Yes. Give praise the Lord.
Praise the Lord.
Usually,
yes. Alhamdulillah. That's what you said?
Yeah.
Yes. Yeah. So I'm just, it's, yeah. And thank you for the gift of sharing that, because I always ask God to humble me every day. He gives me opportunity to stay humble.
Amen.
And hearing that, that'll humble you real quick. Amen. Before I start going down the train of what I don't have, I'm like, you gotta be quiet and be grateful for what you do. So,
because majority of the times we're always worried about what we don't have or what we have to do, but never do we really sit back and say, wow, I actually do have more than I really need.
I have more than I need. I'm gonna tell you what's beautiful about other cultures that I see, like our Hispanic culture, and you know, the togetherness, that tightness, unmatched.
The unity.
The unity, the idea that people will say, we're going to pack ourselves in a 2-bedroom space so that we can build wealth. Come on. Sometimes we have to look at what we have as well and say we actually have more wealth than some of the people that are walking around with wealth in their pocket.
Amen.
The love that I've seen, that is what I desire for my community. The ability to come together. When Farhan talked about how many Somalians voted and how many came out for testing, and I'm sitting here like, that is community. So what sometimes feels like a lack is actually the success is a plus, because you've already beat half the battle. Now let's add more to this. Let's add the education. Let's add the support. We do have support, just like you depend on your community. And I'm talking to the Somalian families, just like you depend on each other for your spirituality, your beliefs, your food. You guys can hold each other up through whatever crisis America has handed to you. You could hold and uplift each other and support each other through this nonsense of substance use and how people are dealing with it. You can hold each other up as you're trying to navigate these awkward talks about sex and how it goes against some of your beliefs, that's okay. You don't have to do it alone.
That's just amazing. That's amazing. I think we went over time, but
We sure did.
yeah. But it was just, I hope this podcast, for all of our viewers that are watching, you guys got some tips from us, maybe even advice. We just hope you guys, so we will be leaving, my information will be right here, Sharita's information will be right there. We are open. You want to share your community, the
Health and Wellness Lounge?
Yeah.
Well, we are pivoting. We'll be closing our doors.
No.
I know. But we're pivoting to be more in our community. So that's more the conversation that I'll be having with you guys. There's enough spaces out here. So the idea is that we want our outreach specialists to engage in those spaces.
Absolutely.
Yeah, like they're here. How can we be supportive to our community organizations that already have established spaces that need our outreach specialists in there? Right. It's just a lot for overhead. And right now with uncertainty, the way it is with funding, I don't want to take the risk. So we're going to be just shutting the door and pivoting to going back out. So it's back to the basics. Yeah, it's back to the basics and saying, we know that what we did learn is the people that came into our space and come into our space are in these other agencies. And I'm like, well, we need to be in their space because it's already established. So if we don't have to worry about, we have connections for hot food. So if our specialists were to come to the Somalian community on this specific day, because you have something that you do every week on this day, we would have our Feed Louisville partners prepare food, which they would prepare it also with the
halal,
what you all would expect for your what types of food you can eat. Like they will design.
So that's that halal.
Halal.
That's the halal.
Thank you, because you've been teaching me. So, but yeah, so it's a pivot, but we'll be the doors will be closed July 1.
July 1.
So. I'm
like the summer. We're there for the beginning of the summer.
Yeah. So we're there Tuesday, Wednesday, Thursday. Our location is 721 South Brook Street. Tuesday, Wednesday, Thursday from noon to about 5:30. We have hot foods. Like I said, they have vegan and vegetarian options, but there's definitely room. They love the cooks there at Feed Louisville are really good about being intentional. And then our admin office is Monday through Friday. For me, it's about 10 to 5. But 9 to 5, we're usually open. We provide Narcan, fentanyl test strips, xylazine test strips, and more importantly, we engage our community to meet them where they're at, provide what they need. So
I like that. Before we wrap up, is there anything you want to leave our audience today in let's say if there was just this clip that was on there on the internet, what would you want people to know about Serita Walden? Look into the camera. You got 60 seconds.
Which one?
That
one. This one, the middle one?
Yeah.
So much I can say. Go, I leave. I know that there's been slogans like, we're in this together. It's actually real with me. I don't ask people to trust me. Try me. See if I really am about the business of the people in our community. And then you'll learn to trust me.
I like that.
Yeah.
I like that.
Yeah, that was my campaign slogan. Don't trust me, try me.
Don't trust me, try me.
Yeah, I don't want people to trust me off the bat. Just try me and see what happens.
I like that.
Yeah.
You always gotta try before you trust.
There you go.
Yeah, the 2 T's.
And I'm not an oppressor. I'm not like white people. You can't. I'm not gonna walk in a room and be like, just trust me. No, you ain't got no evidence that you can trust me yet. So let me
It's
give you
building
some
that
evidence.
Credentials.
Exactly.
Yeah.
Let me give you evidence that you can trust me.
Absolutely. But this was a wonderful podcast.
It was.
Yes.
Thank
this was
you so
amazing.
much.
No problem.
I appreciate this. This was a great conversation.
Absolutely. Well, see you guys again on KY News Podcast, and we're out.